Here we have a fantastic case. These are some of my favorite cases just because the results are amazing. So this patient is clearly a type 4, and we know that because the chest fold angle is way beyond 90 degrees. Another thing is the amount of movement within the nipple is way over, even 6 centimeters. So we know we're a type 4. How do we manage a type 4? So the number one thing that I look for is, where is the chest fold? So here we have the chest fold here, but that's the descended chest fold. Where is the real chest fold? And with him it's exciting because you can see it when he flexes. Go ahead and flex for me. So you can see the border of the pec right there, and relax. So what I've done is I've outlined where the chest fold should be. So it's right at that level. So that's the chest fold. Here is the descended chest fold. The amount of skin I'm going to remove is going to be somewhat less than that, but it's going to end up being here. So we're going to end up putting this back up to create more abdomen when we do that. So I want to show that a little bit clearer, because really we're not removing it down to there. We need this amount of excess skin right here, and it becomes clear why. I'm going to show you that because we're moving the whole chest fold up, I need some skin to do that. So that's going to lay down like that. So we're going to be converting this breast skin into abdomen skin. We're going to remove the skin at that point. The breast tissue will come out at that point. And then at the very end, we're going to be repositioning the nipple into its correct position, which is usually about 2.5 centimeters above the chest fold. So that's the chest fold, that's 2.5 centimeters. So finally, the nice thing about this gentleman is that he doesn't have much fat. We're dealing with primarily skin at this point, and I can do this case under local anesthesia.